Hello, my name is Diana Rivas, and I've had the pleasure to work with Vanessa Gonzalez on this mini lecture regarding foster and adoptive care, in addition to prevention and intervention. Let's begin by diving into the facts behind foster care. Foster care was established as a full-time substitute for parental care provided to children whose parents cannot provide suitable care for them. It is intended to protect vulnerable children from further harm and ideally to provide them with a stable and safe home. Foster parents promote the child's growth and development through a safe and nurturing environment, and they provide care under agency supervision. Foster care is intended to be a temporary arrangement until either the child can be reunited with the biological family or a permanent placement such as adoption can be made. Adoptive care is when parental rights have been terminated by court order. It is a lifelong commitment of love, care, and acceptance to the child. Successful adopters, particularly of children with special needs, have realistic, flexible expectations of themselves and their children. They do not work to remake the child, but strive to help the child achieve success by acknowledging and appreciating small steps towards their goals. They also withstand testing behaviors by their adoptive children, including hurtful, angry, and rejecting behaviors. They do not take it personally if the child is rejecting them because they recognize the rejection as a child's fear of closeness. They realize that the child ties back to their birth family, foster families, and others, and that this is not a form of rejection. They have full parental rights and assume full responsibility for the child. And in last, this is permanent. As we dive deeper into the topic of foster and adoptive care, it's important that we study the motives of candidates. Some foster parents join the foster program to help children through temporary care. Others may be childless. Others may have the belief in a practice of disinterested or selfless concern for the well being of others. They may have a social conscience, which would be a sense of responsibility or concern for the problems and injustices in society, or they may identify with deprived children. So this means that they may have experienced some sort of trauma or neglect in their childhood, or they may have been a foster child themselves. As far as adoptive parents, they may join the program as a desire to add children to their family. So this can come in different scenarios. It may be that the parents cannot have any more children, or that they have remarried and would love to expand their family by adding another child, possibly because they cannot have any more children or their new spouse cannot have a child. They may be replacing a deceased child, and they can have a naive expectation of an ideal child who would meet their needs.
A great deal of preventative methods have been put into place to avoid removing children from their biological homes. This is due to an acknowledgement and understanding of the critical role biological and nuclear families play in the child's life. Attachments between primary caregivers and children greatly impact the children's emotional, social, communicative, and cognitive competencies. Disruptions to secure attachments with biological or primary caregivers have the potential to result in negative behavioral and emotional responses. During the formation of early attachments, one of the primary purposes of the parent is to gain trust from the child by offering security. To accomplish this task, it is critical that the child's basic needs are fulfilled. To assist in accomplishing this task, primary preventative methods have been established. Some of these methods include providing access to resources and financial assistance for nutritious food, providing housing assistance, providing childcare so that the parents may work or obtain education, provide early education for children, transportation to ensure children's educational, medical, and health needs are being addressed, providing programs that assist in reduction of substance use, promoting community engagement, assisting with access to mental and physical health care, and increasing parental involvement. Although primary prevention strategies are beneficial in assisting parents in gaining access to necessities, it does not account for parental behaviors such as parental sensitivity, psychopathologies, or histories of traumatic and unresolved issues. For this reason, secondary prevention methods were established. Secondary prevention methods have been established with the intent of assisting children and families who have been determined to be at risk for neglect or abuse. These services include family resource centers, parent education classes, home visits, in-home support, respite care, treatment services, public assistance, and regional centers. Despite primary and secondary prevention attempts, there are instances in which children still experience physical, mental, or emotional harm in the home of their primary caregivers. Tertiary prevention has been created with the intent of preventing or reducing the impact of trauma and potential of recurring harm to the children. This is the final stage of preventative attempts in reconciling the nuclear family prior to the children being placed for foster or adoptive care. During this time, there is a push for family preservation or reunification, permanency planning, parenting classes, behavioral health services, and crisis intervention. If primary, secondary, and tertiary preventative interventions prove ineffective and children are placed for adoption or foster care, the interventions become focused on the children and parents independent of one another. Interventions for children in foster care or adoptive care may address previous histories of abuse or neglect, inabilities to regulate emotions, behavioral difficulties, and psychosocial or relational concerns. The primary method of intervention once children are in foster or adoptive care is parental visitation. When appropriate, visitation is established to maintain or repair affective bonds between children and their primary caregivers. Bowlby and Ainsworth each highlighted the importance of initial attachments and the impact of those attachments on later emotional and social development. Although parental visitation is utilized as an intervention for children, it is not uncommon for parental visits to negatively impact the child. Several factors may contribute to this. First, if the parents do not show up consistently, the child may perceive it as rejection. Parents and children may continue harboring negative feelings toward one another regarding the situation. It was also identified that seeing parents for visitations and being repeatedly separated from them was hard on the children emotionally. Children in long-term or adoptive care may end up resenting their foster caregivers due to being unable to be with their biological parents. As a result, it is not uncommon for children to exhibit emotional or behavioral upsets following visitation with parents. Additional interventions children may receive while in care include psychoeducation in the group or individual format, experiential interventions, which may include play therapy or role play therapy, and therapeutic interventions, such as utilizing breathing techniques. Two discussion questions we would like you to consider this week are: why is attachment theory important for those who work with foster children? And second, what are methods to assist children in care who experience difficulties acclimating to their foster or adoptive homes? If you are interested in more information regarding this topic, we invite you to explore the included resources. Thank you.